Welcome back. We are continuing our discussion with Dr. Ray Powell from Physicians Plan Weight Management about facial aesthetics, and we were talking about, you know, Botox injections, which a lot of people are familiar with. But let's, moving on from that, let's continue our discussion and talk about another product.
Right. The next product is called Juvéderm, and it's actually going deeper, where we're actually going into the subcutaneous tissue to fill lines and also to help augment structures. And Juvéderm has been around for about 10 years as well. There's a lot of other dermal fillers, but this is the one that I really like using because it's not permanent. It's a material that really I describe as human clay. So I have a couple before and after pictures where this is a woman's lips before Juvéderm, and then we use numbing cream, and this is after, where we've injected it so you can see a fullness to the lips, where it's again giving a subtle appearance where it's not like the giant suction cup lips or anything like that, and it just gives back that fullness to the lip, which is really the amount that's being lost. This next one is where we can use the Botox and Juvéderm. So we're using it on the smile lines, and you'll see after, the next picture is after Botox, but she still has that line. And so what we did, we put Juvéderm in, and then the final picture is where that line is gone as well. And then it makes the Juvéderm last longer because the Botox is in there keeping the muscle from moving. So then the next one is where we're getting into the laser procedures.
Okay, yeah, so I mean, we're talking about going even deeper,
right,
so going in that order.
So the Cutera laser is a laser we use. It's a phenomenal machine. It's actually about 6 laptops in there, and it actually is what's called a platform technology where we can do a multitude of different procedures.
Oh, wow.
We can do hair removal, vein removal, tissue tightening, photo rejuvenation. So I brought even more pictures. This is a chin where you're seeing a bunch of hair. And the way I describe it to patients is that the hair is color, and when we use the laser, it destroys that color, and it causes a destruction of the follicle, and then the hair is gone. The next one is where we do rosacea as well as connective tissue tightening, where it helps give back a nice texture to the skin. So you can see the before and after there, where it really kind of softens the skin and decreases pore sizes. The next one is where we're doing vein. So again, vein has got color in it. It's the blood in the vein, and we use the laser to destroy that vein. And this is immediately afterwards. You can see a little bit of post-redness, but the veins are gone. And we can do this on the legs, the arms, the face as well.
And that's using heat. That's what's causing all of this.
Exactly. We're using heat. And for some of these, it's a little bit of a rubber band snap kind of feeling, so we'll use numbing cream to help as well as with ice. Then the next procedure we do is where we get rid of blemishes. And this is on the surface, and we're using a procedure called intense pulse light. And I'll show you a sequence of a before, a middle, and an after, where we're using this to kind of really get the colors to come down, and it can take several treatments for this to happen.
Would these be like freckles, or are these sunspots?
Exactly, these are both. It's called a solar lentigines, which are age spots, liver spots, sunspots. They're called different things, but the thing that we have to tell patients about with this is that it'll look worse before it gets better. It gets a little bit dark and speckly, and then it just kind of sloughs off like a little brown scab over about a week. And so they do it several times to get the full appearance done. So the laser is a really interesting procedure. Then we can use a procedure called Tighten, where we're using a deep layer of skin to help tighten the skin underneath with energy, which is again heat. So you can see the before and after of what it does around the stomach. We can even do it on the face. So the next slide shows where we're tightening the skin right along the jawline. And again, it takes 1 to 2, sometimes 3 procedures, depending on the level of sag that the person has. But all these are lunchtime procedures, so they can really go back to work. And they're not dramatic to where they're all of a sudden seeing the result, but it happens over time.
Okay. Now let's talk a little bit, we were talking about hair removal. Let's talk about when people, sometimes they want those eyelashes to grow. They start to thin.
This is a really neat new procedure, or a new medicine called Latisse. And Latisse is actually an ophthalmologic medicine that was used for glaucoma, but they found that when it was put on the eyelashes, it actually made the eyelashes grow longer. So here's a before and after of 0 week to 16 weeks, where it really makes the eyelashes nice and full without having to do a lot of cosmetics to it.
Wow, that is a big difference.
It's a big difference. Women just love it.
All right, can you put it on top of your head?
No, it'll make the hair, you'll have to have more haircuts, but it won't make new hair grow.
Alrighty. And a lot of these, I mean, you've heard a lot of people having some great success stories and people feeling a lot
Right.
better when this happens, huh?
Oh yeah, exactly. They get a great response from it and they just feel better about themselves.
Okay, well, doctor, we're going to let people know how to get in touch with you
Right.
if they're interested in any of these procedures. When we come back, that's about it for this edition of North State Health, and we're going to take a quick break, and then we're going to wrap up with Dr. Ray Powell, today's guest. So stay with us.